Okay, good afternoon, everyone, and welcome to today's community conversation about how health coverage and access to care help build a healthier economy and why access for everyone is important to both business owners and leaders. Our panel today features distinguished Texas leaders, including Rodney Ellis. Rodney Ellis has dedicated his life to public service, first as a Houston City Councilman, then for 26 years in the Texas Senate, and now as Commissioner of Harris County Precinct 1, which includes our Community Health Choice headquarters. Commissioner Ellis is a committed bicyclist and leading a public health campaign to increase health coverage. Next on our panel today, we have Ismail Porsa. Dr. Porsa is president and CEO of Harris Health System, which includes our Harris County Public Hospitals, Ben Taub, and LBJ, as well as our Harris Health Clinics. Dr. Porsa has an extensive history of medical and health leadership right here in Texas and sees the economic impacts of the insured and the uninsured Texans each day. Next, we have Frances Dias. Frances is president of Houston Easton Chamber of Commerce. After starting her career in communications, she began building relationships with business leaders, and today she works on the front line with employers and business leaders and brings insights into why coverage matters to all of us. And last but certainly not least, we have Dr. Vivian Ho. Dr. Ho is the James Baker III Institute Chair in Health and Economics. She's a professor in the Department of Economics at Rice University, as well as a professor in the Department of Medicine at Baylor College of Medicine. Dr. Ho's research is at the intersection of health and economics, and among her many distinguished achievements, I'm happy to say she also serves on the board of directors right here for Community Health Choice. So we are going to start today with Dr. Ho, but before we start, I'm going to ask Aaron to launch our first audience survey question. Aaron, can you put up the survey question? So our first question is, how are you insured? One, through my employer, job, school. Two, I have my own insurance, either through an individual marketplace plan or other non-group coverage. Three, Medicaid, or four, Medicare, or last, I don't have health insurance. And so we're going to give that a moment. Aaron, let us know when we have enough responses in. So most of our attendees today have their insurance through their employer, their job, or their school with 86%, and 6% have their own insurance through the marketplace or other non-group coverage, and then another 6% don't have health insurance, and just 2% Medicare or VA. And so, with that, thank you very much, Aaron, for putting that up, and thank you for those that responded. So let's jump into the discussion today. And Vivian, let's start with you. We'd like you to help us understand two really significant parts of the conversation. One being why anyone's health coverage should matter to anyone else. So, in terms of our economy, what's really the cost of being uninsured?
Well, thanks, Lisa, for having me here with such an impressive group of experts on this particular topic. So let me step back just a bit. Why do we have so many uninsured? Insurance isn't a household staple. It's not like bread or milk, where you have lots of competitors selling the product and the providers or the sellers make more money the more customers that they have purchasing their product. Instead, what we've had in the health insurance market and in terms of providers, healthcare providers have figured out that they don't have to serve everyone. They can actually make more money by serving by selling to employers. So having employer provided health insurance where they can charge very high prices. And unfortunately, employers aren't pushing back on those prices because of the tax advantage of compensating their workers in terms of health insurance. And so what this means is more money is made by charging those high prices, which leads us to so many uninsured people. We have something like 5 million uninsured people in Texas, which is larger than the population of many other states. And what this means in terms of the cost to everybody living in Harris County is we have high taxes at every single level paying for this. We have high property taxes at the county level. We have high federal taxes that are going towards paying what are called disproportionate share payments. I believe those are close to $2 billion this year in just going to Texas. And we have billions of dollars going towards a Medicaid waiver because we didn't take the Medicaid expansion. Again, billions of dollars. And so those are things that are driving up our own federal income taxes to pay for them.
Well, thanks for that. So you talked about a lot of things from just the taxes, the uncompensated care. So when we sort of think about, we talked about the cost to everyone for being uninsured. The second significant thing is understanding how this health coverage and access to care helps our overall economy and our economic development. So could you maybe talk a little bit about that?
I think the best way to find this out is actually to look at the experience of states that chose to expand their Medicaid under the Affordable Care Act and compare them to the experience of states like Texas, which has not. I believe there's 12 states left, and there's been lots of studies. If you actually look at the Kaiser Family Foundation, they have a report on the effects of Medicaid expansion with over 1,000 studies that have looked at this. And so just talk about the insured people. This is a terrific benefit. These people who get Medicaid expansion coverage report better self-reported health, better health behaviors in terms of they can do things like manage their diabetes better, that lowers preventive hospitalizations, lowers hospital length of stay. There's even a study that shows there's lower opioid-related mortality. Now, for an employer, also, health insurance coverage is shown to reduce sick days. But if you think more expansively, it turns out that the states that expanded Medicaid actually were able to save money in their state budgets on expenditures on healthcare. And that's because they shifted some things that were only sort of state-related monies onto this federal Medicaid expansion, so it's covered by federal dollars. And not only that, there's also been reports, talking about the multiplier effect. If Texas expands Medicaid, we have billions of extra dollars, federal dollars, going into our economy, and that leads to greater employment, not just in the healthcare sector, but through the entire economy, because these additional dollars that are paid recirculate through economy over and over. They start in the healthcare sector, but they get spent in other parts and would lead to better growth for the entire state.
Wow, thanks so much for that, Vivian. It seems really clear that covering people helps contribute to our economy. Now, Commissioner Ellis, you have this whole picture in Precinct 1. You have insured, you have uninsured, businesses, schools, hospitals, and clinics. How do you see the connection between coverage and the economy play out?
Well, they're very interconnected. And thank you for having so many experts on the line. They know it far better than I do. And I appreciate Community Choice pulling us together. But look, if people don't have health care coverage, that means they end up going to visit Dr. Porsa. And obviously the taxpayers have to pick up that tab. We have one of the highest uninsured rates in the country in Harris County. Harris County is massive. In fact, there are more people living in Harris County than in the entire state of Louisiana. We'd be about the 25th, 26th largest state in the country. If the county is a separate state, it impacts our economy. I mean, so much of what we do evolves around quality healthcare. Even the uptick that you see in crime, by the way, to some extent is a reflection of mental health crises out there. So it's a big problem for us, which is why at the county level, we're doing as much as we can to encourage our state partners. Take the money from the federal government. It is our money. As Dr. Ho was making reference to states who have done it, really 2 states matter the most who have not drawn down affordable health care money. 2 big ones, Texas and Florida. And insurance is the business of sharing the risk. So it's important that you have more people involved, because more people who pay, that's what sustains our insurance system. But it is a big problem for us. And if we don't continue to get that waiver, so we are taking federal money in another way. If the Biden administration does not grant that waiver, it's going to close even far more hospitals, particularly in our rural areas, than we have now. So they're directly interrelated. I just think that public health ought to be considered a right and not just a privilege for those of us who can afford it.
Thanks so much for that, Commissioner Ellis. And I mean, you mentioned in your comments that when people don't have insurance, that they would be visiting Dr. Corsa. And Dr. Corsa, we know you being the CEO of the Harris Health System, that you see the impacts from the lack of coverage each day. Can you share with all of us what that means to a system like Harris Health?
Sure. Good afternoon, everyone. And thank you, Lisa. Thank you, the Community Health Choice, for putting this program together, and an honor to be among this panel. Yeah, absolutely. Hopefully they're not coming to see me personally, but they're coming to Harris Health System for their care. But yeah, the impact of having one of the largest uninsured population in the country, in Harris County, what that means in terms of the people themselves is, you heard from Dr. Ho, and you heard from Commissioner Ellis that in terms of not having access to care, what that means to the person with regard to their health. Less access to primary care, less access to specialty services, less access to behavioral health services, and what the impact is on the person's health. Financially, I can tell you that last year for just Harris Health System, we spent just north of $700 million in our uncompensated care for the indigent and the uninsured, less than half of which was compensated for by the federal government in terms of supplemental payments to our system. Well, the rest of that money has to come from somewhere. And you heard, I think, from both panelists prior to this, that that's the money that our taxpayers are being obligated with. So there is a direct impact on the health of the population that doesn't have access to care because lack of insurance. There is a direct impact financially to us as a society because of this. You heard a little bit from Dr. Ho about the economy of not having health coverage for the masses. Now, United States continues to lead the world by far in terms of our per capita expenditures on healthcare, way ahead of the curve from any other country. And yet, when it comes to outcomes, we really don't fare well to the rest of the countries. The reason behind that is, this is the way we spend money. You heard about the high cost of health insurance and the reasons behind it. And it's also, this adverse or kind of a crazy way of the way we're spending money and very, very high cost care rather than globally making healthcare accessible to the masses. This creates, that high cost creates a situation where, I guess, preferentially the health insurers decide to not provide affordable healthcare coverage to the masses. That creates a situation where the masses are not getting access to healthcare, so they become sicker, the cost goes higher, and this vicious cycle continues. Let me stop there, and then I can add on later on. But thanks for that question, Lisa.
No, thanks so much. And I mean, we talked about just the high cost of healthcare, and earlier in our poll, we saw that 86% of people receive their insurance from their employer. And so with that, I'd like to bring Francis into the conversation and look at what employers and employees are concerned about regarding health insurance and our economic success. Francis, what concerns are you hearing?
Employers know health insurance is a popular benefit, but particularly small employers are faced with high cost, and employees can be faced with the higher premiums. We just got over a huge pandemic where if you didn't have insurance and you had to go to the hospital, you were faced with decisions, and some of them just didn't have it right now. So I know some companies that would like to offer employer-sponsored group insurance and just can't afford it, and others who feel like it is a personal personal thing, and that they and their workers can choose whether or not that they want to get their own coverage. Some businesses owners have never seen their connections between healthy people and the healthy economy, which is huge, because if you have a healthy employee, then they come to work every day and they don't take a sick day, et cetera. And even when they do, they may not even know how to help their employees get coverage. At the chamber, we had a recent sit-down conversation with some of our members in the insurance world. And it was great to see how they dialogued with one another and how they want to help other small businesses. Because in that survey that you did, I know a lot of those folks probably are not the blue collar folks that are in some of the small businesses that are out there. But those folks, the poll may have been different had they been given it themselves. So I know that there's a lot of folks out there that just don't have insurance themselves.
Yeah, and that is really a great point, I think, between one, the small businesses and then the people who don't have insurance. And we know that recently that through the marketplace exchange that there's been additional offerings. And I know Commissioner Ellis, you and your team here in the county are helping to really promote this coverage. Can you really share a little bit about what you all are doing?
So Lisa, the Biden administration extended the deadline to sign up to August the 15th, and they added incentives to make it less expensive for more people to get coverage as part of the federal legislation that went through Congress. That's a good thing, but we have to get the word out. So we are doing billboards in conjunction with you all. We're doing mail, we're doing social media. You know, we've had people walking in neighborhoods, whatever it takes. We're researching to see if we can get some of our utility providers to maybe put a notice in when they're sending you a bill, no matter how mobile someone is. If you're in an apartment complex, you're probably paying a light bill or a water bill. But it's word of mouth. It's whatever works. And that also adds to the political acceptance, hopefully, of having access to healthcare. But thanks to the leadership of your team and everyone on the Zoom, we're doing everything that we can so people take advantage of the extension and the incentives.
Yeah, and speaking of the incentives, let's look at some examples of how individuals are saving on the ACA under the special enrollment period authorized by the American Rescue Plan legislation. Aaron, would you show the slide?
Thank you. I was trying to remember it.
Perfect. So here are some of the savings, and I actually was looking at these prior to the start of this Zoom and am still just really taken back. So if we focus in on number 3, which is the family of 5, you have someone who lives in the household 48, 40, 18, 15, and 13 respectively, with a household income of about 70,000, and they select a bronze plan. Before the SEP savings, and this is before the savings from the extension and the American Rescue Act, they were receiving about $1,182, but still had a monthly premium payment of about $419. And then you fast forward to after the SEP savings, now they're receiving an incentive for almost $1,400, bringing their monthly premium for a family of 5 to $13.19. And so my question is maybe to Vivian, what would you add to our understanding of how employers can help employees obtain coverage?
So in addition to these federal dollars out, there's other legislation that people may not be as aware of. There are HRAs, which are short for Health Reimbursement Arrangement or Health Reimbursement Account, so that an employer can actually cover the sort of provide dollars for employees to spend on medical care. It's deposited in an account, and it's also tax advantaged for the employee. The employee has to spend the money on the healthcare service, and then they get reimbursed through the account. And so that helps in terms of savings in terms of taxes instead of paying out of pocket. There's also something called, it's abbreviated IC, HRA, and I don't know as much about it, but this would actually, the employer can use tax advantage dollars to actually help the worker pay for a health insurance policy. If they don't have one provided through work, there can be an assistance, and that could be used to purchase health insurance from, say other sources. And then also there's legislative things going on, and Commissioner Ellis probably knows much more about these, but there's been discussions of having the federal government offer health insurance Medicaid expansion to particular counties in Texas, since the state's not willing to take it. And then just this morning in the Chronicle, there was another story talking about a legislative proposal for the federal government to step in directly and provide Medicaid policies to Texans as well.
Dr. Ho, that is an important point, and I'm in Washington now, and if the federal government were to decide to let counties do it, I certainly would support it, and I think that would be to support it in Harris County to draw the money down. It would just save the taxpayers so much money. Or at some point will the federal government do it? It is important to note that under American Rescue Plan, those incentives are only in place for a couple of years, but it's great. And premiums are going to decrease on average $50 per person, $85 per policy per month, and 4 in 5 consumers will be able to find a plan for $10 or less per month. I have two of my kids who are off my insurance now because they're at that age, and sometimes they wonder, can they afford to pay their premiums under Affordable Care Act? And I tell them, yes, if not, I'll pay it. One catastrophic illness, particularly what we went through in this pandemic, could end their futures. So in my case, my kids are lucky. If they didn't pay it, I'd do it for them, but everybody can't do that. Folks should sign up, take advantage of this opportunity.
Yeah, and when we talk about taking advantage of the opportunity, and Commissioner Ellis, you're right, some of those premiums are so expensive right now. For instance, do you know if employers really have an idea of not only the coverage options, but just how low some of these premium prices are?
Yes, and some do, and some don't, and that's the interesting factor here. Some businesses didn't even survive the pandemic, where others have a lot of turnover resulting from the pandemic. So we're in a moment where access to healthcare is a huge part of what we've all as a nation experienced. But yet my sense is that many of our employers, particularly the smaller businesses and startups, some of them are so focused on survival that they're not even thinking about healthcare coverage for their employees, other than the need for healthy people on the job. But it is one thing that everyone is offering bonuses for sign up for new employers. Maybe this is going to be a turn where people are going to be offering healthcare as a benefit to bring in more employees. It's desperately needed, and it's something that I hope that we can all work together and spread the word they should do it.
Commissioner Ellis, Dr. Porsa, anything additional you'd like to add to that?
Yeah, I was just gonna, as much as I really don't like talking about COVID-19, it seems like you really can't participate in a panel without talking about it. And I know Francis mentioned COVID-19, kind of brought to mind, going to the previous conversation about the impact of not having access to care and broad healthcare coverage. What it meant, I think COVID-19 taught us a lot of things. I think one of the most important lessons was the fact that, not having access to healthcare, you kind of get used to it, and then all of a sudden you have a pandemic. And what happened as a result of that, we had disproportionate impact of COVID-19 on the same segment of the population that is chronically uninsured, indigent, and the devastating impact that it had on the segment of the population without health insurance, but also then the cost. You just heard about, the economic cost, what it meant to the businesses that were devastated because of this. So it really kind of is an interrelated situation here that, those individual healthcare coverages when you look at it across the society, across the communities, it really has a huge impact on the community as a whole. So this conversation about, why businesses should care, it really matters to the bottom line. And I just wanted to add that to the conversation.
No,
insurance is one of those things that most people don't fully appreciate until they don't have it. Right. When I was a kid, my parents would say, they'd use that line, it's better to have it, not need it, than need it, not have it. But it can be a life-altering experience if illness comes along and you don't have health insurance. So it is just so important.
Thank you very much for that. So we're going to open it up to questions from our audience. So while Robin and Aaron are gathering questions, I actually have a question. And Dr. Porsa, as you talked about just, COVID and the impacts of people being out of work and just the whole socioeconomic piece, when we think about not just healthcare, but we think about the social determinants of health and how we need to wrap around services. Maybe you and Vivian, can you talk about just the economic impact there and what people may be experiencing?
Sure. Maybe not so much the economic impact, but the economic undercurrent of what happened. And what I mean by that is this. You talked about the social determinants of health. For those who may not be familiar with this, the science is very clear that, what we as physicians and doctors and nurses and health systems, what we do at the end of the day has some impact on your health as a person and as a community, but the majority of the impact on your health is really what we call the social determinants of health. Where you live, the food that you eat, the water that you drink, the air that you breathe, your education, your employment, things of that nature. You talked about the impact of COVID-19. I mentioned the segment of the population that did not have access to healthcare and how they were devastated by COVID-19. This segment also happens to be the part of the population that had occupations that also put them at increased risk of being exposed to COVID-19. Kind of a lower paying jobs that did not offer days off, jobs that did not offer healthcare coverage. So as a direct impact of lack of, social determinants of health, the impact of COVID-19 and then was a direct result of that. In addition, just to the blunt not having access to health coverage.
Thank you. Vivian, anything you'd like to add?
Sure. I did some work with Blue Cross Blue Shield Association to look at their data because we thought there would be a massive loss of health insurance amongst the employed. And surprisingly, there wasn't that much loss. Part of it because there was additional assistance and companies stepped up to help employees. They would lay them off, but still give them their health insurance coverage. Okay, that doesn't mean that it wasn't bad. What it means is the people that Dr. Porsa has been talking about and serving who have been suffering without health insurance all the time, they were the ones that really got stiffed on every single component. And so really the health insurance is part of this larger picture that Dr. Porsa is saying in terms of social determinants. And when you look at it, there was a fact set in the paper this week that 1/3 of Harris County adults are functionally illiterate. Okay, so what I am concerned about is when I get old, I will not have the nurses I'll need when I go to the hospital and get sick. I will not have the firefighters to protect my home. I will not have educated police officers. So this is just a broader picture. We have to make it easier for low income and middle income people to get by. And one significant portion of that is giving them access to health insurance coverage so they can get the preventive care they need to stay healthy and be productive members of society in the long run.
Wow, thanks very much for that. And so another question that's come in, and Commissioner Ellis, this is probably for you, as you talked about the federal government. So if the federal government does begin directly sending Medicaid expansion dollars to the county, could Governor Abbott step in to stop it?
I don't think he can under the current law. They could try and pass a law to keep us from taking it unless the federal government overrode that. You know, I should mention the picture over my head, by the way, is LBJ. Give him a shout out. It was only some 50 years ago when he passed health care for people who couldn't afford it. By the way, he started off politically with getting health care for people in my age group now. That was more politically palatable, as difficult as it was for people over a certain age group. And then he went later on and included for people based in poverty. But, you know, I hope that we get beyond the political, cultural wars we're going through, where we're fighting over the little stuff. You know, the legislature's put caps on what we can do in terms of funding things on the local level as it reduces what it does. And, you know, I used to joke when I was in the legislature, and I said one time on the Senate floor, any idiot could pass a tax cut. I passed one. At the time, it was the third largest one in the history of Texas, and it's having fun. But most problems that come across a serious policymaker's desk cost money. Yeah. Only things that don't will be those resolutions. They just cost trees. You know what I mean? But, you know, most things in life that matter, unfortunately, there's a price associated with them. And, you know, I just hope we get beyond a little petty political posturing. I know it's fun, but at the end of the day, regardless of what party somebody's in, we got to govern this place.
Yeah, thank you very much for that. And so we have another question. Is it health insurance that's needed, or simply better access to affordable primary care to those that don't have it now? Who would like to answer that?
Let me take a stab at it. It's obviously both, but I don't believe that you can have without the other one. And what I mean by that is that the reason primary care and specialty services and behavioral health and obstetrics care that are so expensive is what we've been talking about this hour, which is the lack of a comprehensive universal healthcare coverage. That is directly leading to the higher cost of health insurance for those who have it, which then increases the cost of care, which then increases the cost of the healthcare coverage. And again, it becomes this vicious cycle. So it's really both. I don't think you can have one without the other. And the other thing I was going to say, and not to downplay the impact of, you know, having county-sponsored or federally sponsored Medicaid, we also need to actually look into the Medicaid laws in Texas. Because even if today we had Medicaid expansion, you know, we would not still, a large segment of our population would go without coverage just because of the way the laws in Texas are created. So, you know, yes, we need Medicaid expansion would be wonderful. But we also need to think about the way the Medicaid is administered.
Yeah, agreed. And Francis, there was a question that came in, and I think you're uniquely positioned to answer this just because you deal with businesses, where someone was wondering, because they were laid off earlier this year and they've been on unemployment, should they use COBRA or apply for an individual plan during this SEP? What are you sharing with other business leaders about this question?
Thank you. And I think that that's really an individual's choice, because the employer gives them that option. The employee is the one that has to make the decision. One, can they afford it? Because COBRA can be very expensive, short-term and long-term, and it doesn't last very long. So I feel that it's the individual decision to make, if they can afford it. And then two, are there any other options out there, you know, like the services that are provided, that they just probably need to educate themselves also on some of the clinics that are around that could possibly maybe provide some assistance until they can get back on their feet and get to another employee that, one, offers insurance, or two, that they can get insurance on their own. But I know that all businesses care deeply about the health of their, well, they want to, but they just, you know, one, can't afford it, and I will give them that option. So they're lucky to even have that option, because some don't even have it.
Yeah, And so speaking to that, I mean, one of the questions that came in is, does Harris County or Houston offer health coverage for residents, for general folks that live here?
I don't believe so, and Commissioner Ellis can correct me. But
No, we don't. Well, thanks to Dr. Porter and his board, they did put up some money to help buy insurance for people, as opposed to having to go to Harris Health uninsured. But no, we don't do that, only for our employees. Now, it's something I may think about, by the way, with some of the money that has come from my federal partners. I think about, just as we doing direct payments, I'll make sure I add that to the mix. Thank you for bringing that up, Lisa. Maybe send me something, and my staff, you work with a lot on it, create some advocacy around that. Even if we only did it for a short amount of time, there are people who would benefit from that as much or more than the direct assistance that we're giving to people. So I'd look at that. Thank you.
Yes, absolutely. We will definitely make sure we follow up with you on that.
And if somebody around the country is doing it with some of the money that's come from our federal partners, it'd be interesting.
Yeah, I think Dr. Porsa would be more than interested in talking to you about this offline.
Absolutely, and Commissioner Ellis, yes, definitely. But you mentioned it. I just wanted to expand on it. Harris Health System, we currently have close to 25,000 people that we are helping them with their subsidies to be able to be insured through the marketplace. This is something that other businesses, other health systems could also participate in. Imagine, a world where businesses would band together here in Harris County to not just provide healthcare for their own employees, but actually create a consortium where we could pay the premiums for individuals to participate in marketplace. It is not a very expensive endeavor, but it is one that would pay back multifold. So Commissioner Ellis, I would love to help you champion this cause.
And I hope my staff is watching, or some of some of the viewers. It always helps politically, I think, when I look at best practices. And sometimes I used to joke and say that the last original idea was Socrates or Aristotle or somebody. But if I can go look and see where it's happening somewhere else, make adjustments, you benefit from what has worked and what has not worked. If not, we can be on the cutting edge. But most of us in government always say we're the standard for the country with no metrics to prove it, by the way. But no, I'm very interested in that.
Thank you. Thank you. And Vivian, a question came in about the tax credits. Can you maybe help explain to the people that are listening how the tax credits work?
Well, so if you are buying a plan on the marketplace, what happens is you don't actually receive directly the money from the tax credit. The tax credit goes to the insurer, and then you see a discounted premium. And so that's the way it will normally work. With the additional funding from the Biden plan, there will be some people who are unemployed who they signed up for a particular plan already. And if they stay in it, then they may receive a refund on their next year's tax, because it'll take into account the additional money that came for the administration. But I would encourage them to call up an insurer and sort of see if they can get a better plan for cheaper, because these are really good sort of dollars that are being rolled out, so you can get better access to healthcare than you did before, and it won't cost you anything.
Or better if I do it.
Thank you for that. And there's someone's asking the question around where can they find out how much they would pay to cover their family? And you can really find that information out at healthcare.gov. CMS has a lot of robust tools on their site that you can enter information, and they can share with you what they believe your premium would be. And then they can also share with you a variety of health insurers, such as Community Health Choice, that you can select from for your coverage. And so that's healthcare.gov. And the team will be working to put up a slide that not only gives the URL, but also shares the phone number. Another question that we've had come up is, would the federal or local government in Texas consider publicly funding some treatments for high-risk conditions such as opioid use disorder, as it has been the case for COVID-19 vaccines? And the question further goes on to ask, when states are experiencing budget shortfalls during this pandemic, universal coverage may be difficult to push, but coverage for some high value treatments may be feasible. So what are your thoughts on that? If would Texas consider publicly funding some treatments for high risk conditions such as opioid?
I think it's worth making the case. Politically, it's very difficult to get it passed. You know, one reason why I hope the federal government will, to some extent, overrule what our state government does and give us the option is, I think it saves us money in the long run. You know, even while we're dealing with this uptick in crime, as an example, in Cook County, Chicago, they use the affordable health care money to provide mental health coverage for people who are in the jail. Now, some people in jail just because they're bad actors, obviously, but many are there experience homelessness or mental health issues. And you could save a heck of a lot more money if somebody just got the treatment, if they got the pill, instead of spending the money to warehouse them. So I'm just thinking as we go through this to kind of make that case, and particularly, you know, the state's got a lot of money. You know, it's pretty transparent what the city of Houston will do and what Harris County will do. We're going through this process with a lens of equity at the county. State got a lot of money and they're getting ready to go build a wall. You know, I for one would not have favored giving as much discretion to governmental entities, because there's a tendency to go spend it where one gets political points, not necessarily to help deal with generational poverty, which is a separate discussion, but a big challenge for the future of our country.
Definitely a big challenge. Anyone else like to add to just if we should think about, the state should think about billing for specific treatments, especially during this time period?
We don't do it that way, and I think it's for a reason. In terms of the administrative problems, it's really hard to do. If you think about the fact that the CARES Act threw $50 billion at healthcare providers to cover the costs of caring for COVID patients. And then we found out afterwards that when they gave it out so quickly, they actually gave it to the richest hospitals and not to the rural hospitals and the primary care providers that needed the money the most. So it's just really hard to do. And when you think of it, if you tell all the providers, okay, we're going to give you all money for opioid treatment, suddenly every provider, well, most of the providers will be honest, but then we'll have a bunch of providers who are going to go out there and reclassify everything as opioid treatment. So it's administratively really hard to do.
Thank you. Thank you very much for sharing that. Another question came in. So Francis, there is a segment of the population that their companies don't offer any type of health coverage. They would like to provide some suggestions or some talking points to their employer about potential options through the exchange. What do you suggest that they share with their employers?
That's a very, very good question, because some companies, if you have 4 or under employees, 5 or under, you don't have to provide insurance. But I would just suggest and maybe put a case to where maybe they can provide a stipend, $650 a month, $500 a month to help offset some of the expenses that they have, and give it to them every month. And it's the same amount to every employee. It's a little bit that will help a long way. In addition to that, maybe there's other healthcare opportunities, bringing in people that will give information about proper diets, wellness, other preventative measures, working with organizations like yourself to bring in some of the doctors and experts to maybe teach them on better ways to live in a healthier life. And then, when the employee does grow, maybe that is something that they can consider, is providing those type of insurance plans for their employees. It's really a struggle out there for some of these businesses, but there's a way to balance it.
Thank you very much for that. And so, Vivian, earlier you brought up ICRA, the Individual Consumer Health Reimbursement Accounts. And the questions come that asking, do you see merit in asking employers to consider embracing the ICHRA or qualified small business health reimbursement accounts to help subsidize individual access?
Oh, I absolutely do. Yeah, it would be as Commissioner Ellis and Dr. Forza, they're having problems getting information out, and if we could work out a way to get the information to tell employers that this is a possibility, this is something they can take action on. But that it's not the only thing. We have to take a multi-pronged approach, because the problem is, even at certain higher incomes, once these subsidies sort of peter out from the pandemic, there's a lot of middle income household that have very high premiums on the marketplace. And so we've got to sort of push against provider prices, which are much too high as well.
Yes. Thank you for that. There's another question actually for you, Commissioner Ellis. It says, thank you, Rodney Ellis, for helping the public be aware of this SEP. Do you recommend that everyone signs up, and why?
Yes, and look, it's so difficult with so many ways to reach people. We get information overload. So to the extent we have public figures that help, or popular people, and they may not necessarily be the trusted messengers we politicians think we are, but we try to think outside the box. And I sometimes talk to my kids, by the way. Millennials in particular are such a big problem, because when you're young, you feel invincible and don't realize it. Now, I don't want to go back to COVID again, but one of the biggest challenges would be those young people who have not been vaccinated yet, particularly with a variant coming on. So look, I'm open to any ideas. You keep trying. You don't give up. I think a big problem with us, because we have such a large uninsured population, is we don't have a culture of regularly going to get checkups. Now, my age, I think about it around my birthday, but I'm at the point now where I want to go every 6 months. Thank God the county gives great interest, had them draw my blood. You got me just to check. But it's a big challenge, and I'd be open to your viewers giving any ideas they have.
Well, perfect. Thanks for that. We've had a few questions come in specifically around premium rates and places that they need to look. So Robin and Aaron, if we could put up the slide that shows individuals on how they can access more information about the exchange, that would be great. So for those of you that are asking questions specific to your health insurance premiums and specific to incentives and where to sign up, this is where you can go to healthcare.gov, or you can call 1-800-318-2596. Again, that's 1-800-318-2596. This website will share with you everything that you need to know, not only about just different options for healthcare coverage, but also potential pricing, and then specifically ways that you can sign up. So again, it's healthcare.gov, or you can also go to communityhealthchoice.org/apply, or call us at 281-524-4880, and we will help you apply for coverage and also share with you plans that we readily have available right here in Houston, in Harris County. So thank you all for that. Another question that's come up is just really around incentives, and the incentives that we've talked about specifically to Marketplace underneath the American Rescue Act. Vivian, can you maybe share about the incentives that we are seeing and how you feel like people can access them?
Oh, you mean the ones where you showed the slides and the reductions in the premiums? I almost feel as though they're self-explanatory, so if you were based on your household income, and the premiums are determined based on your household income primarily, and whether you can get access to affordable insurance through your spouse or something like that. There are various different restrictions, but there are certain conditions in which you had to pay before a monthly premium, and there are going to be plenty of people who are going to be able to get a plan for free. So look on healthcare.gov or call Community Health Choice, or ask your friends if they know a good insurance broker. The insurance brokers all know about this, and this is a terrific opportunity. And I think there are a lot of people who will be pleasantly surprised about what they can afford with this particular assistance that's out there.
I want to stress, because we have such abject poverty in Harris County. 4 out of 5 consumers will be able to find a plan for $10 or less per month in Harris County. So that's the only upside of having so much poverty. It's just well worth doing that. But Genius says, oh, my staff or your staff, put that in my talking points, but that is just such a startling statistic. And in part, it's a reflection of the poverty that we have in Harris County.
Yeah. And I think it also shows just the opportunity that's available for folks. When we're talking about $10 a month or less, you talked about earlier, just one catastrophic and what it could do potentially as you move forward in your life. $10 a month, if it's affordable, it's well worth it. So we definitely agree with that. So yeah, the American Rescue Act and some of the incentives that they have applied for folks is just astonishing these days. And so we have 7 minutes left. And so I want each of you to leave us with some closing remarks as we think back to really the purpose of the panel discussion is around just access to care and the economic impact. And so with that, why don't we start with you, Commissioner Ellis, just your closing remarks to the thousands of people that are listening both live on this Zoom discussion and via Facebook and Instagram.
Yeah, nothing matters more than your health. And just remember that line, when it comes to insurance, you just never know how much you need it until you don't have it. And it's better to have it and not need it than need it and not have it. Thank you for inviting me.
Thank you so much. Dr. Porsa?
Yeah, I just wanted to emphasize the previous comments about the affordability of healthcare coverage through the marketplace. For those of you who just assuming that this is something that you can't afford, please, please, please go to the website or contact the Community Health Choice. There are plenty of options. Commissioner Ellis mentioned that you'll be surprised of some of these options, how affordable they are. So please do yourselves the favor and educate yourself.
Absolutely. Francis?
Yes, and to tack on to that, if you are a business owner at the Chamber, at the Easton Chamber, one of our Chamber members, it's called Benefit You, and they have programs to help save money for small employers, 25 to 999 employees on up to 500 employees. Just do your research, find out, there's companies out there that are there willing to help you. And if they can save you some funds, by all means, go for it, because the employee benefits, it stops loss. And that's what we all want to do. We want to have healthy employees that can come to work and stop the loss of a sick day, et cetera. Thank you so much for having me.
Thank you, Francis. And then Vivian?
If you are an employee with good health insurance coverage, but you're sick and tired of those premiums taking such a large part of your paycheck, start speaking with the employer, start speaking with your representatives. The reason why that insurance is so expensive is because the health providers are charging us too much money, and we're sitting back and taking it instead of getting out and saying something about it. And it's time to fight back. The healthcare providers have been terrific during the pandemic. They've really stepped up, the individual doctors and nurses, but it is their bosses, the executives, who decided that they can take advantage of us and charge high prices and get away with it.
Vivian, thank you very much for that. And so before we go, we're going to go back to the slide that shows for folks out there that are needing coverage. As we've mentioned throughout this hour, this is the time. There are many incentives out there that are available to help you attain coverage. You just need to go to healthcare.gov or call 1-800-318-2596. please go online and check, because the Biden administration has put a lot of assisters out in the community to help people sign up firsthand. If you have any questions, please feel free to ask. If you want to know specifically about Community Health Choice, you can go to communityhealthchoice.org/apply, or you can call us directly at 281-524-4880. I want to thank each of you for joining us during your lunch hour today to talk to us about this very important topic, access to care, and more importantly, the economic impact. My name is Lisa Wright. I'm the president and CEO here at Community Health Choice, and I thank you all for your time and attendance today. Have a great rest of your day. Bye.
Thank you.
Thanks. Bye.
Thank you. Bye, everybody.